To discuss these latest figures, we're joined by Professor Barry Schoub. Professor, good afternoon and thank you very much for your time. I must say, very concerning. 1 million. That is a very big number. What do you make of these latest figures and perhaps our own position now as South Africa on COVID, given that we have done away with the reporting of daily figures? It seems everybody has become so comfortable. Is it concerning?
Yes, good afternoon, Funda. Thank you for having me. Yes, those are global figures, and certainly in some parts of the world, if you look at Japan, Australia, and others, they really are suffering quite grievously from COVID. They are having, in fact, some of the highest death rates that they've had since COVID started in those countries. In South Africa at the moment, we are fortunately at a pretty low but stable level. We're having something like about 200 cases reported daily, which is far lower than what we had when we were in the midst of our peaks. So we at the moment are kind of at the low level. We've come out of our fifth wave, which probably ended around about June. We're at a low level now. Our mortality is also really a small handful. Of course, each case, as Maria van Kerkhove said, is a tragic case, but it is at a low level at the moment. So we can afford at this stage to release some of those restrictions. The big problem that we've got in South Africa is our low vaccine uptake. It is very low, and we need to kind of increase it quite urgently because we're not totally out of the woods at the moment.
So wouldn't you think that it would be beneficial perhaps to go back to reporting the daily figures, or they themselves would create the confusion if we see such low numbers, then people decide that, then I don't need to go and vaccinate?
Yeah, it would. If we could have accurate figures, it would certainly be useful because it would certainly impart that information and alert the population to at least kind of bear in mind that COVID is not over. I mean, do need to take the precaution. The only problem, of course, is getting those accurate figures because now many people who have COVID, fortunately, get it fairly mildly and don't go for testing. That's the one thing. The other thing is that, of course, there is home testing kits, which never get reported, and even many of the antigen detection kits, those statistics never get reported. So that our reported cases, in fact, is quite an underestimate of the true number of cases which are circulating in the country at the moment. But unfortunately, there's not really much one can do about it to try and improve those figures.
Why do you think there's no appetite to continue to encourage citizens to vaccinate on the part of government right now?
It's a difficult one. I think we need to have good communicators, peer communicators who can go to the communities and kind of encourage people to be vaccinated. I think it's really an educational program appropriate to all our populations in the country to kind of impress on them that the vaccines are safe and effective and are needed. Yeah, I think this is really where we are. It's a challenge. It's a difficult challenge, but I think it's one which needs to be implemented.
Do you foresee perhaps another wave in South Africa, or you're thinking, as some have thought, that perhaps to a certain extent in South Africa we're now safe, we've reached our herd immunity, so we should fairly be safe going forward?
Yeah, Fundi, I don't think really that this concept of herd immunity is a realistic one. We will always have coronavirus or SARS, whatever the designation will be in the future, a coronavirus. That will not simply disappear. Unfortunately, the virus does mutate, and unfortunately, the mutations up to now shown that they can evade immunity, either from vaccine or from past infection. So there always will be the threat. So there certainly will be another wave. I think there's little doubt that we will have a wave, probably the end of next month, maybe even into October. We hope that it's going to be much milder, and certainly the fifth wave was milder than the fourth wave. But there will be a wave, and it's just for that reason that people who are not adequately vaccinated should go and get vaccinated.
So what precautions should we take beyond vaccinating, and for those that need their boosters, to get the booster shots? What else should we be doing now? Because everybody's done away with masks, we're interacting more, going to social gatherings. What should we be doing to try and protect ourselves?
Well, I think there are two things that I think we can reasonably still do. I think we're heading into the warmer season. So I think that certainly indoors should be well ventilated. And we can afford to do that with our warmer weather. We can have the windows open. We can have good ventilation in closed venues. I think that's important. We should try and avoid overcrowding, particularly if there's not good ventilation. And also, I think it still would be wise to wear a mask if it's an indoor setting, an indoor milieu, indoor environment where there isn't, for whatever reason, good ventilation and there's overcrowding. I think in that situation, it would be a wise precaution. I personally certainly would do it in that kind of situation. So I think those two things, ventilation and masks under certain circumstances, I think we should retain, in fact.
Professor, thank you very much for your time this afternoon. That is Professor Barry Schoub joining us from Johannesburg. More